I'm Al McFarlane. Welcome to Conversations with Al McFarlane. Pleased to have a new friend in the community to be on today's program. Dr. Courtney Jordan Beckler serves as the medical director for the Minneapolis Heart Institute Foundation and guides their emergent science centers that include women's cardiovascular work, prevention, and global outreach. She is a general cardiologist at the Minneapolis Heart Institute, and she's passionate about a healthy state of well-being, body, mind, and spirit. And she's a national leader in integrative medicine and wellness. Dr. Beckler previously served as the Assistant Commissioner for Health Improvement for the state of Minnesota, and she helped grow and lead the Penny George Institute for Health and Healing at Allina Health. She served on the National Prevention Committee for the American College of Cardiology and the Minnesota Department of Health State Prevention of Cardiovascular Stroke Committee. I may be saying that wrong, but we'll clean that up. Courtney, Dr. Beckler, thank you for being here. How are you today? And you have to unmute for me.
I'm great. Thanks so much, Al. It's really exciting to be here having a chance to speak with you.
Well, likewise, the pleasure is all mine. We're working together on some projects that we'll talk about over the course of the interview. But my objective today is simply to introduce you to the listeners and viewers and ultimately the readers of Insight News for the work that you are doing. And I want to start with a general question about how you see yourself as a physician and why you've chosen this field of cardiology and what you gain as you serve both the community, your patients, and the profession. So let's start there.
Awesome. Well, what a great question. I was actually thinking about something similar on my prep and thinking about this interview of what's drawn me specifically to cardiology. And I think what I love most about cardiology and heart disease is that 85% of it is preventable. So there's this great opportunity to make a difference in people's lives from never have to have it, right? But then what I also find unique about cardiology is if you do have something happen, we have great second chances. And so for me, I love the opportunity to work together with patients and help navigate that road ahead, what that looks like to make it through a cardiac event and make it to the other side and hopefully have the highest quality of life they ever could have imagined. So it's exciting that opportunity to do both, hopefully prevent it, but if you go through it, have a successful outcome. And then lastly, I would say I also have a huge passion for helping folks die with dignity. And so, inevitably, we all are going to go out of this world. We all are going to die at some time. And that is common to also be from heart disease. And so I think to be able to walk that together with another human being, that vulnerability that goes with that is really a rewarding experience for me.
That's great. What's your training and your background? How did you focus your attention to this field?
Yeah, so interestingly, I went into really wanting to be an obstetrician. When I went into medical school, I actually spent the year before I started medical school doing AmeriCorps. And I worked on the north side with North High School and then also Southwest High School and some of the Minneapolis high schools around teen pregnancy. And just loved that experience of getting to know a group of young women and everything. All of these women had children at this point, and we were really focusing on their health, the well-being of them and their children, and spent a lot of time with the YMCA, exercising together, cooking together, everybody bringing in what mattered to them from a cultural perspective, teaching each other, reading together, going to Barnes and Noble for free things, for free reading events and stuff. And it was incredible. And that's kind of what I thought obstetrics and gynecology would be like, and sort of was disappointed for me. So long story, it led me from medical school to really fall in love with internal medicine, where I felt like we got the opportunity to follow the person as an adult all the way to their death, and then subsequently to cardiology, where again, I loved sort of all this innovation that exists within cardiology with valves and stents and defibrillators and procedures, but also ultimately that prevention aspect. I took an interesting turn after my intern year, which is the first year after medical school. I was distinctively remember being at in residency that intern year at Regions at the time, Regions Hospital, and I admitted a patient overnight that was young. She was in her late 30s and she had high blood pressure that was in the emergency range, and so we had to admit her. And then we quickly got her blood pressure under control. 2 days later, she went home, and they had this policy that if the same person came back within 2 weeks, you admitted them again from a learning perspective, so you could see perhaps if you could have done something differently. And this young woman came back, and this light bulb went off in my head. We hadn't talked about nutrition. We didn't know anything about where she lived, her availability to get the medicines we prescribed, what her home life was like, all these other things that were influencing her blood pressure management. And I woke up thinking like, the system's broken. Like, of course she's back. How could medicines alone fix that problem? And that led me into kind of pursuing another path while I was pursuing my medical training. So I ended up doing a master's in epidemiology and public policy at the University of Minnesota School of Public Health because of my interest and love for population health, recognizing that 80% of our health outcome is outside and independent of healthcare, but really wanted to kind of bring those two worlds together.
That's fantastic. And so the specialty then of population health and cardiology allows you to do what? Now, let me ask you, are you, as a heart physician, what's the realm of your medical work? Are you a surgeon? Or tell me what you do.
So I specialize in prevention, but I'm a general cardiologist, so I definitely do not do surgery, and I don't put in stents or valves myself. Some of my colleagues and partners have extra training in interventional cardiology, or surgeons in that case. So the work I do really focuses on both that primary prevention and then secondary prevention if somebody, after they've had an event. I spend half of my time clinically in the clinical setting with patients, and then the other time doing research, working in communities, working on policy. And I really, it was in 2007 when Minnesota was working to pass the Freedom to Breathe Act, which was where we started to get smoking out of bars, that again, another light bulb went off to me of how many people you can impact by putting in policy things like that impact the health without you having to think about it. And so I was still in my training at the time, but I worked legislatively and realized how interested legislators were at hearing physicians' voice. And it just made me understand kind of the power of getting those degrees and training, that what you could ultimately use that voice and expertise, hopefully, again, with the goal of preventing some of this from ever happening. So I do both. Right?
Okay. Well, so let's talk about the Minneapolis Heart Institute Foundation, the institute itself and the foundation, your role in both of those organizations.
Yeah, so the Minneapolis Heart Institute is the largest cardiovascular center within the state of Minnesota, and that's really where the cardiologists and the interventionalists and the cardiovascular surgeons live. So I practice medicine there, and we're now partnered with United Heart and Vascular Clinic. So we have kind of the Minneapolis Heart Institute West and the Minneapolis Heart Institute East in St. Paul. So that's really the clinical arm. And then we are paired with the Heart Institute Foundation, which is where we do research, education, and community outreach. And that really spans the gamut of how we work together in partnership in the community, how we help educate other physicians, some within cardiology, some without, because, as cardiologists, we're really biased that kind of the heart touches everything. And then we also do a lot of research, both locally and nationally. So it's a great combination to be a part of.
Well, I'm excited that you're going to be collaborating with Insight, and you and my daughter Batala, who's the publisher of Insight News, have been working together to create some important conversations about heart health in our community. In fact, the project is being named Heart to Heart Conversations, and they'll feature you and colleagues working with me and others to talk about different elements of heart health and how things are not isolated, how everything is connected, right? And I'm looking forward to, as part of one of 5 town halls that we'll be doing, you interviewing me about my story. And as our intent is to allow an expert like Dr. Beckler to talk to a real-time heart patient or heart person who's got a heart event, put it that way. I'm not your patient, but I'm a citizen who's had heart challenges. And so I'm looking forward to talk to somebody about how I felt and what I was doing, and how I've approached trying to have a quality of life and to live a long time, and to hopefully, in my discussion of my story, provide you with an opportunity to talk about the universe of challenges and the universe of strategies that people can use to have effective, quality, longer lives. Is that the right way to discuss it or to describe it?
I think it's perfect. And I am just truly thrilled about this partnership. And I think, Insight does so much great work, but as you've always done, you bring the stories, right? You are the story. You're talking about what's happening both to yourself and from a community perspective. And by not purposefully, but I'm sure as you've experienced, sometimes in medicine and healthcare, we get so focused on evidence-based medicine and the guidelines, and cookbook medicine is fairly easy to say you should do this, and this. But as you pointed out, the universe of how, why, where, when, who that does and doesn't happen to is the art, and is really, I think, best told by the patient, best told by the human, to help people navigate how you really live and thrive when you go through this. And I just think I'm really excited about that opportunity to make a difference and to close some of these gaps that we see.
Well, so for listeners, people watching on Facebook or YouTube, what we did at Insight several years ago, and this is at the direction of Batala and with her leadership, is created a project that was quite successful. It was called the Insight to Health Fitness Challenge. And we created a page in the paper called the Insight to Health page. That's our newspaper health section every week. And our objective then was to actually organize 10, 20, 30 people into a rigorous fitness routine at a gym directed by trained professional fitness trainers, fitness leaders. And so we started the project in St. Paul, and then we, in the past year or two, moved it over into North Minneapolis, which is where our home base is for Insight News. And I think that once we come through the COVID distancing protocols and can sort of regain what we used to do in gyms, we'll be bringing the Insight to Health Fitness Challenge back, but this time it'll come back as a component of the new and improved approach that Batala has created. And that project is called iHeal. iHeal is the acronym for Insight Health Equity Action Lab. And I think it's such a wonderful idea, and it's a purposeful idea. It declares our intent to look at ideas and research in a way that's different, research coming from the community, directed by the community, and intended to be of service to the community, honoring the voice, the narratives that come out of the community, as you just described, Dr. Beckler. And we hope that the start of this project as a partnership between iHeal and the Minneapolis Heart Institute Foundation will be the beginning of creating a storytelling capability that invites our community to be knowledgeable about health, to adopt expanding vocabularies about health, adopt the tools to explain our feelings, our experiences, and our aspirations, and to motivate us to be proactive, to do things individually and collectively, like you said, lobbying, city government, the state, the legislature. How do we create an awareness that informs our ability to I think, draft, design a future that really reflects the quality of life that we want and we deserve. So that's kind of where we are. And we are thankful to you, Dr. Beckler, for your leadership and for your service, and for you being able to bring together such a great institution to work with us in community. And so let me ask you about that. Your studies led you into population engagement, research and data, and with the specialized knowledge of medicine and health. Where do you see us going, and what do we need to do, you and I together, the Institute Foundation and Inside News, to help create equity around health in North Minneapolis in particular, but in the Black community in general? What do you think?
Yeah, well, I think you nailed it in that it has to be designed by the community for the community, with where the interest lies from the community with some of the medical experts, if you will. And I think, again, what's so exciting is back to that love of cardiology is the leading cause of death for everyone, but unfortunately at a disproportionate rate for Black Americans is heart disease. So we can change this because there's lots of room to do tremendous things, from very upstream things of living, how easy it is to thrive in your community, which is some of the work that you and Batala have already started, to what it looks like to get equitable care and to feel comfortable at the clinic, and to feel like trials are designed for you, and because we know people do better who participate in trials. So I think that the opportunities are endless, but I am really excited, biased of course, but I think that the Heart Institute and Foundation is really a powerhouse when it comes to cardiovascular disease research, education, commitment on the clinical side to changing these norms. So bringing together these two groups, I think that the opportunities are endless to co-create and have a different outcome for generations to come and really break this cycle.
I have this picture that I described, Dr. Beckler. I think that, number one, our community is known for being ground zero of all the worst health disparities, and also economic and other disparities, education. Minnesota's a great state. One of the best states in the country, but it's always a tale of two cities, right? While the majority of Minnesota, white Minnesota, lives stellarly and exemplary, engaged lives by and large, by most indicators, the same is not true for Black folks in Minnesota, and that we have some of the worst outcomes in the country in health, in education attainment, in business access. So the quality of life is really different. So what is it that we have to focus on, and how do we focus on that? So all that to me is a problem, and at one level, I call problems a good thing. It's work that we can do. And so my approach to these dilemma is not to say, woe is me, why is it so bad, but to recognize what it is and determine what we need to organize to take this problem down step by step, chunk at a time, and with the belief that we can do this, that we're up to the challenge, and we can create, as you said, or as I said, co-create a future that works for us, that reflects our importance to ourselves, our families, to our neighborhoods, and our partnership in the overall design of community. So I have the vision that since we have been identified as the worst place, why not set the goal of being the best place?
Yeah.
And I'm hopeful that the kinds of things that we are doing will lead to a public mind in North Minneapolis, where North Minneapolis decides and declares it will be the healthiest community in the state of Minnesota. I think it's doable. And I think it's a question of education and inspiration. Inspire, instruct, and inform. That's what we call the 3 I's for Insight News. But I believe we can do that. What do you think? Am I over ambitious here?
Not at all. I think it's completely doable. And like you're saying, you're surrounded by cities. Medina, for instance, has one of the highest life expectancies in the entire state. So why can't we bring that? And it's not even bring that, right? It's design that. It's have the community declare what that looks like. And I think it starts with large, big goals and grabbing and going for it, So I think it's fantastic. I'm with you. I'm your champion.
Well, we're going to do we've got a series of 5 town halls planned so far, but it's part of, I think, an 8-session curriculum that you created. Preview that if you would. What if people want to join, support, be a part of this series of town hall meetings? We're also going to be doing some research out of sort of people's knowledge, sort of get a baseline of who's listening, but people can join this program. But talk about what you're going to talk about over the course of the 5 sessions.
Absolutely. So I created a curriculum that, as you mentioned, is about 8 sessions that will sort of morph into 5, but that was really designed for communities, and we've piloted it in the communities, but with the idea that the interaction that you have with the physician is usually pretty short, and you don't have the time to get into the nuances of all these different things above and beyond what was prescribed or what procedure was done, that you need to be able to have that education that you're saying, be empowered to take the next step that's right for you. So this will be broken down into a little bit more understanding of what is heart disease. That alone is kind of confusing for folks to have just a little mini primer of sorts on the pathophysiology or the bare bones of what heart disease is. What medication somebody might have prescribed and what they actually do. So just a little what we would say pharmacokinetics. But so that understanding of why you might feel a certain way or things to expect can be really helpful as people are navigating what medicines, why, and how. Nutrition specific to overall heart health and longevity, movement, and then purpose, is a really big one that we find the difference between someone thriving and sort of barely surviving with heart disease really gets to that whole person, mind, body, spirit. How do we feel best versus just looking at the heart? So I think there'll be a great opportunity to touch on all of those. And lastly, mental health, I think, is a big driver. We know it's 30% of all heart outcomes, and how do we change that trajectory and, kind of look at this head on. So it's going to be exciting.
As you were talking, I was thinking about my experience. My challenge was CHF, congestive heart failure, right? And Batala and I were at one of our fitness challenges where we're getting up 4 days a week, I think, at 6 in the morning and showing up at the YMCA down in Heritage Park. We had 30 people showing up, at 6 in the morning and putting in a hard hour, of really grueling, grinding workout. And so one day she said, "Dad, you don't look so good." I said, "Oh, really?" Because I just wasn't aware. I'm sweating, So, well, as a result, I ended up going to, the emergency room myself. I drove myself later in the day, but that's when we discovered I had something going on. And so, I'm so glad that she paid attention to me. I'm so glad that I paid attention to her. I listened to her, and I listened to my wife when I came back home. She said, "Tell Dad's got to go. Get him out of here. Not get out of here, but get him to the hospital or to the clinic." And I did, and that led to the diagnosis and to some being able to pay attention. And so learning about what it is that's going on is a good thing. And there's still more to learn. You don't ever learn it all. But to have this conversation with you and to invite other people to share and talk about their experiences and their intent and desire to create a livable and better outcome is going to be a wonderful thing.
Yes, it is. It's going to be exciting.
Well, listen, for those who are interested in knowing about this, I can give them the Insight News email address right now. And if you have an interest in being a part of this series of town hall meetings, reach out to me, actually, McFarlanemedia@gmail, and we'll send you information on how you can connect and be a part of this conversation. So it's McFarlane Media, McFarlane media@gmail.com. We'd be glad to share with you what we're going to be doing and invite you to be a part of it as well. Dr. Beckler, give me a little bit more on your background. I ask this all the time because I'm a curious guy. I'm a journalist, right? So what did you want to be when you were 5 years old?
I'm pretty sure when I was 5, I wanted to be a lawyer. It wasn't until 8th grade that I was set on being a doctor. So yeah.
How did that transition come about?
I'll tell you, it's so the impact that a teacher can have is just amazing. So I was in a science class in 8th grade where this teacher would say every time who did better on a test, a girl or a boy. And I'll never forget, because you hear all these stereotypes about girls not feeling like they can exceed in science, and you would see objectively on the board, it would kind of alternate a girl, boy, girl, boy. And so we would race to the room and we would write like women rule on the whiteboard, and the guys would erase the WO, so it would say men rule. But it was just nice, healthy competition. And once a month, they would have little videos on what you could do with science. And one time they had one on a physician, and I do not come from physicians. And I saw it and thought, that's it. Like, as you can tell, I love to gab, which is a good and bad thing. And but then it took kind of the love of math and science for me, together with having the opportunity to know people's stories. I mean, it's really similar to the work you do with the lens on the science side. So I just forever will be in awe of getting to be a part of somebody's life that way.
Great. Well, listen, thank you so much. I'm looking forward to our collaboration and the conversations we're going to have. And for those who are listening on YouTube or watching on YouTube or Facebook, reach out to me directly, McFarlanemedia@gmail, and I'll give you more information, tell you how you can be a part of this upcoming series, heart-to-heart conversations. It's going to be great, and I'm looking forward to it so much. And be a part of our intent, our shared and mutual intent to change the world by changing North Minneapolis first. We can do this together. Dr. Courtney Beckler, thank you so much.
Thanks, Al.
Okay, Bye-bye. We'll talk to you later. Bye-bye.
Bye.